Hi, I'm Dr. Rose. Did you know that May is National Stroke Month? Causes of stroke are varied. Person can have hypertension or high blood pressure, and that can lead to a stroke. People who smoke have a higher incidence of stroke. If you're overweight or obese, there's a higher incidence of stroke. If you're a diabetic, you're more at risk to have a stroke. If you drink alcohol, you're more at risk for a stroke, and lack of physical activity can also lead to stroke. What are the symptoms of stroke? You could have sudden weakness or numbness in your arms and in your legs. You can have slurred speech. You can have a droopy face. You can have blurred vision. You can have all of a sudden get a severe headache, and you could be confused. What do doctors do for a person that has stroke? Well, they might give medications. Anticoagulants or blood thinners is one of the first drugs that they might give to the person depending upon the kind of stroke they have. They also might give them statins. Sometimes strokes are caused by high levels of cholesterol that form plaques within the blood vessels. And if that happens, the statin drugs will reduce the cholesterol in the person's blood system, and that will cause the blood to flow freer and not block the main arteries to the brain. They could also be given by the physicians antihypertensives. You need to know what your blood pressure number is. You should keep track of what your cholesterol numbers are, your lipid numbers, both your total cholesterol and your high and low density lipids, and your doctors can give you those numbers. The higher they are, the more of a chance you're going to have a stroke. You also might be given an ACE inhibitor that will control the way your heart beats and will regulate the blood flow to your heart. People who have strokes need supportive care, especially immediately after the stroke. More than likely, they're going to be hospitalized. They'll need to be on a cardiac monitor. After that, the doctors will decide whether the medicine does its job or whether the person will need surgery. Sometimes people have what's called an endarterectomy. And what that means is that the doctors, especially if it's a carotid endarterectomy, and your carotid is right here, they'll go in with a little tube or a catheter, and they'll roto-rooter out the artery that goes up on the side of your neck into and lets the blood go to your brain. Generally, that's an outpatient procedure. You can see people go into the hospital and have this procedure done, and then they go home the same day. They don't put anything in there to keep it open. It's just blocked enough that if they go in with the tube and they push it up and down, then the patient will have enough cleaned out that will prevent further strokes. Sometimes the tube isn't enough, and so a stent might need to be put in. A stent is a little plastic tube, and they make a small incision on the side of the person's neck, and they put in this little tube that will keep the area open when the patient goes home. Some people after stroke need to go to a rehab center. Might be an inpatient rehab center or an outpatient rehab center. Some people with stroke will need speech therapy because the portion of their brain that was affected with a blood clot affected their speech, and the speech is garbled, so they work with a speech therapist. Some people need to work with an occupational therapist because their motor skills have been disrupted. Maybe they need help walking or feeding themselves or remembering where things are. So the occupational therapist can help the person and the family deal with this. If the person has several areas affected, usually they're put into inpatient rehab. If it's only one or two areas, then the person is able to go home and the family can take them for outpatient rehab. But no matter what, you need to be aware of all the symptoms and be aware of your surroundings and the people around you, that if somebody has a droopy face, or they're walking funny, or they are dragging their leg behind them, that's when you need to take action and you should call 911 right away. Thank you for listening, and we hope to see you again at Oakwood Creative Care.